Evening, everybody, and welcome to the next Conversation with a Doc. And while Clarissa Ocampo is not a doctor, she is a speech language pathologist. Before she became a speech language pathologist, she sang professionally. She has an album called Cradle Songs, and she sang for 25 years before she began her career as a speech pathologist. Really, I urge you to Google her because she's got a fascinating background. And now, Clarissa, it's all yours.
Great. Thank you so much, Judy. And I am very, very pleased to be here with you tonight to talk about the SLP connection, what the role of a speech language pathologist does for individuals with Parkinson's, and how we can help with your overall rehabilitation process. So I hope you all can see my shared presentation. Let's go ahead and begin. So there are three components to Parkinson's that occurs when you during the course of or the progression of the disease, and one of it is voice. So usually this is what we call a non-motoric symptom of Parkinson's, is that the individual will start to have a breathy voice, they'll start to have hoarseness, they'll start complaining about hoarseness. And most of it really is, I can't hear you. There's reduced loudness overall. When you are in conversation with family members or even in a social setting, a lot of people will start, asking you to repeat yourself because of that reduced loudness. So voice has become one of those markers for Parkinson's that will actually get that individual to start talking and have conversations with their neurologist or with their doctors. So these are some signs of a voice disorder in Parkinson's disease. The voice gets very breathy. It gets hoarse, there's reduced loudness. There's also what's called reduced pitch variability, which means the voice starts to become more monotone. There is no natural prosodic melody that of the voice. When we're talking, the voice is usually going up and down, and it's got a lot of expression. We sort of lose that when the Parkinson's disease starts to kick in. There's also, because of the reduced loudness, there also starts to have like a more effort associated with speaking. And because you're giving more effort to speak, the fatigue starts to kick in when you start to use your voice for a pretty long period of time. So all these um, all these symptoms that happen with your voice basically becomes more bothersome to you in the long run. However, outside of the voice symptoms of Parkinson's, there is also a swallowing component. So the voice and the swallowing mechanism is actually the same system, right? The larynx is where the vocal folds are. And the vocal folds, when you are voicing, they need to close at 100%. Once that vocal cord starts to get weak, you're now, the vocal folds itself, they actually bend and create a gap, what we call a glottic gap, which is basically an opening to your airway. So you have to bear in mind that the vocal folds or the vocal cords is your last door to your airway. That's the one that really protects your airway. If those cords are bent from weakness, then your airway is open. So when the voice starts to get weak, I would say most of the time, or most likely, there will also be some sort of a swallowing difficulty because now things are going into your airway. So the swallowing in Parkinson's disease, there is what's called aspiration pneumonia associated with dysphagia. And aspiration pneumonia is when material such as secretions, food, anything that you're drinking, starts to fall into your airway and into your lungs. It's that repetitive occurrences of aspiration that can lead to the illness. So it's not, a lot of people are get very worried when they're aspirating that one time, thinking that they're going to get sick. No, it's actually that repetitive aspiration is what really leads to that respiratory compromise. So once we start in our clinics, once we start to think about a person with aspiration, we are actually looking at how long has this been happening, right? So it's not that single occurrence, it's how long has this aspiration been happening? How long have you been having these swallowing difficulties? So it says that in some of the reported surveys, there's a prevalence of swallowing symptoms in about 12% of individuals with Parkinson's disease. And it usually happens more towards the progression, so towards the later stage of the disease that individuals will start to um, experience or develop swallowing. Now, again, this is all very individually based. It doesn't happen all the time. I see patients who don't have swallowing difficulties at all, and they're enjoying a non-restricted diet. They are enjoying going out to restaurants, but we still do have part of the population who will have some swallowing difficulties at some point. Now, some of the reasons for dysphagia is the rigidity of the tongue. Now, remember, Parkinson's is a motoric disease, right? It is that area of the brain where that is impaired. Therefore, if you see symptoms, I usually say if you see outer symptoms, things that you see outside of the body, like the tremors or the shuffling gait, that's actually also happening inside your system. So the tongue becomes very rigid. The tongue is not able to move and control the food that's in your mouth, right? Because of that rigidity and also because of the dyskinesia. So you can have um, lingual tremors that makes it very hard for you to control the food that's in your mouth. Now, there's also other reasons for dysphagia, wherein now the larynx, again, you have muscles that are attached to the larynx that moves the larynx up and down. The larynx has to move up and over for you to for you to complete a swallow, right? So the larynx has to go up and it has to go over. And that movement is all very muscular. When there is rigidity or dyskinesia, chances are that larynx is probably going up and down, but it's not able to go um, over, like it's not able to do that anterior excursion, what we call. So it's not really completing the swallow. So there now becomes a deficit in that the food is not able to move safely down the throat, therefore it gets stuck in the throat. So we get a lot of patients who will report, they're coughing with their meals, they are having food getting stuck, they're not able to clear it. That's basically what's happening, right? And then a lot of the new research now are also showing that anything that is esophageal or gastrointestinal are being seen or are actually fairly common with patients with Parkinson's. So again, these are muscles that are functioning within our bodies. So there's what's called an esophageal dysmotility, which basically means that the food is now not going smoothly down the esophageal into the stomach. And because of that dysmotility, we have sensations wherein we feel that the food is getting stuck in our chest. Okay. So these are some of the reasons of dysphagia. And the risks that we look for with dysphagia is the fact that now there is not a there isn't a proper absorption of the food. So you can have malnutrition, you can have dehydration, and of course that aspiration pneumonia. So there are other complications, other comorbidities that can happen when there is a swallowing disorder. The third component, so we have voice and then we have swallowing. The third component to Parkinson's is the cognitive piece. There is, so Parkinson's does not always lead to dementia, but we do see a lot of individuals who develop dementia in the later stages of Parkinson's. We do see that quite a bit. However, there is what's called a mild cognitive impairment that is associated with Parkinson's. And what exactly is that? So, a the cognitive abilities of an individual um, also starts to slow down, right? So we have patients who will actually um, report, memory loss. They'll start reporting not recognizing familiar faces or not coming up with the names of loved ones. These are all, signs of dementia, but it's actually not. It's just what's called a mild impairment in cognition. And this happens because as the body is slowing down with Parkinson's, the mind is also slowing down with Parkinson's. There is also some slowed processing speed, right? So an individual with Parkinson's is going to need some extra time. When they are being asked a question, for example, they need that extra time to respond. So it's not a quick response that they are able to do. They need a little bit more time to process the information, to think about what they're going to say before they can even say it. But remember, because the muscular component of things are slowing down, sometimes it's actually also difficult to initiate the actual act of speaking. So these symptoms, all of these symptoms sort of look like, oh, this person has cognitive issues or this person has dementia. Not necessarily. It's basically Parkinson's related. Okay. So out of those three, the voice, the swallowing, and the cognitive communication deficits that we see in Parkinson's, there's been a it's more of like I would say a gold standard to treatment, or at least a go-to treatment for Parkinson's, and that is the LSVT LOUD and LSVT LOUD for life therapy. LSVT LOUD is a research, and it's been going on for about 25 years or more now. And it first started by Dr. Ramig. And what it is she developed a protocol that targets actual Parkinson's symptoms, right? So that is what LSVT LOUD is. LSVT is for Lee Silverman Voice Therapy. That's the acronym for it. And Lee Silverman was the very first Parkinson's patient that Dr. Ramig was working with to develop the entire protocol. So some of the benefits of LSVT LOUD for voice, swallowing, and cognition is that so now we are working with increasing vocal loudness, right? So we put you through a treatment program wherein we are actually encouraging you to talk loud. There is also part of the program is also to improve articulation and speech intelligibility. So being mindful that when you are going loud, you are actually giving more effort to speak at a much louder vocal intensity or a much higher vocal intensity. Therefore, to do that, you are now needing to articulate and to speak more intelligibly. basically, right? So that energy transfers to the oral articulation, and also it improves intelligibility. It also improves intonation because I don't know how many of you have had LSVT loud treatments, but we do what's called pitch flexes, or you go from one pitch and then you go up to a high pitch, or you start with a high pitch and you come down, and you do that for a pretty much high repetition, a number of repetitions and sets. So that will improve that vocal flexibility that you will basically need, right? So that the voice becomes louder and it becomes more pliable. It also helps with improvements in facial expression because, again, when you are trying to put a lot of effort in vocal production, the facial muscles will have to move. It will have to kick in. So that helps with that masked face, right? So what we are is we are encouraging a lot of effort, a lot of energy to produce that vocal loudness. At the same time, we are building prosody, we are building and redeveloping that, the facial muscles, the oral muscles. Um, it also helps with neural functioning. So the neuroplasticity part of LSVT loud is the high intensity, right? It's the high repetitions, and it's really targeting those neural networks in the brain that will help with recruitment of trying to go loud. So it's interesting that a lot of people who have gone through the treatments, they think that it's all just about, being loud. It's actually not. We're actually targeting a lot of areas, not just the voice. We're actually targeting the neural network that helps with recruitment of vocal intensity. What's also important to know is because, as I said earlier, the voice and the swallowing have the same mechanism. When the vocal cords start to get stronger from the exercise, those cords are now beginning to close much better, which means that you're no longer having that airway gap, right? So your airway is no longer open because those cords are pliable, they're closing, they're vibrating. So the swallow is actually getting better. There is also, when you go from low to high pitch, that larynx has to go up and down. So there's also movement of the muscles that are attached to the larynx, and it's going up and down. Therefore, that's what we need for swallowing, right? We need the larynx to go up and over. That's what the swallowing action does. So it helps with the laryngeal elevation, the movement, and also the anterior excursion of that of the larynx. Therefore, the swallow becomes complete, and it helps with um, keeping you safe with your with oral intake. Okay. Um, it says also that there is basically the neuromuscular control of the aerodigestive tract. So when you are putting a lot of effort, when you are getting your body to put a lot of effort to give an increased vocal intensity, you actually have to recruit a lot of muscles. It's not just the larynx. You are recruiting, your breath muscles, your respiratory muscles. You're recruiting basically pretty much everything. You're recruiting your entire body to get you to that level where we train you to be. So it also helps with getting you, with getting you to that level wherein you are able to digest your food a lot better. Okay. So I want to give you, this is a really great picture of, this is a picture of what the benefits of loud is. So if you look on the furthest left, it'll say there's a baseline, um, there's a baseline MRI, right? Wherein if you see those red and orange areas, that's all that's being fired when with individuals with Parkinson's disease. So basically what's happening is those neural firings decrease. With treatment, post-treatment, right, there's a voice treatment and then there's the articulation treatment. You see how much that orange and red areas are. So those neural networks are really firing with the activity. And further right, it says 7-month follow-up. So you're still having continued neural firing 7 months after you have treatment. So those are the benefits of LSVT loud. Now, for those of you who are not familiar with LSVT loud, LSVT loud is it's basically our go-to treatment. Like I said earlier, it's been studied for over 25 years. We are recalibrating perceptions of what loud is. So what happens is as your voice gets softer over the years, you lose that perception of what exactly is normal. So we need to recalibrate that. We need to get your auditory perceptions used to giving a much louder voice, right? So we need to recalibrate those perceptions so that we can get you back to what we deem as a normal vocal loudness. It is a program. There are 16 sessions of 1 hour, one-to-one therapy sessions. It's 4 consecutive days a week for 4 weeks. So that is, and there's a reason for that intensity. The reason is that high, remember, we're targeting the neuroplasticity of the brain, and we need that high repetitive, high intensity, and high occurrence of the exercise for it to be beneficial. That's why the program is designed this way. It's 16 sessions for 4 consecutive days a week, plus you are actually doing homework. So although you are seeing us for 4 days, the other 3 days you're doing it on your own, right? So not only are we targeting those neural pathways, we are actually also developing behaviors and habits that hopefully after the program, you will be able to continue to do these exercises. So these are exercises that will be with you, or at least you would like to do, for life. It's like taking a walk. It's like taking a 30-minute walk, daily, right? So that's where we want you to be with with the LSVT Loud program, is that we want it to be more of a habit for you. Loud for Life is one of the ways to help with that carryover. So not everyone is able to maintain that, 7 days a week of twice a day practice. That's very difficult for many. So LSVT Loud, or LSVT Global, which is the company, developed what's called LSVT Loud for Life. And LSVT Loud for Life is a group exercise class. So you are now being put into a group class, and it's literally like going to yoga, or it's like going to an aerobics class, right? It's there's about 10 to 15 people in a class, and you all do the loud exercises together, and you have that you partner up and you do some exercises with each other. So it's really for those who have completed the LSVT Loud program, because like I said, it's a carryover. It's part of the maintenance for Loud. It's helping with accountability, because you are now, coming to group at least once a week. And hopefully that's, really good reinforcement for you to try and practice every day. It keeps you motivated, it keeps your voice strong, because at least you are getting that regular once a week, or four times a week, however many you would like to go to. But it's also helping you, it's supporting you, from getting yourself to not do the exercises, right? So Loud for Life is actually there for you so that it helps you, it supports you in maintaining your goals of exercising, hopefully at least once a day. So this is the image. This is the last image I have. And this is basically what soft speech looks like. So the picture on the left, basically what's happening is, uh, because of that softer speech or softer voice, the respiratory muscles or the respiratory strength also decreases. Therefore, there's not enough breath support to pull that voice out to go a little bit louder. So now the lungs start to reduce in size. It gets weaker, it starts to reduce in size. It's not able to pull up as much air as it needs to be able to produce that voice. Therefore, we get that vocal weakness, right? And then it's not triggering those neural pathways in the brain because right because there's not enough um, energy that is actually going to the brain when we are speaking soft. Now, with training for a louder speech, if you see the respiratory capacity starts to increase, we actually get a better respiratory strength because that's what we need, to get that voice to get louder, and those neural pathways are much stronger. It transmits stronger energy into the brain, right? So that's basically what it is. So if I do host a Loud for Life group in Annapolis, and if anyone is interested, this is how to get in touch with me, or you can also call Judy. She will connect you with me. We have, every last Wednesday of the month. We also have what's, with Max. I do host a support group and an educational session wherein we talk about more in depth about the voice, about swallowing and cognition, in those educational sessions. So you can definitely, please feel free to get in touch with Judy, and she will connect you with me. So thank you very much, and I'm welcome for any questions that you may have.
Well, okay, I've got some pre-submitted questions, and just in case you've all forgotten, if you have any other questions, feel free to just put them in the chat, and we'll make sure that Clarissa answers them. So the first question is, I notice that I'm speaking more slowly and not enunciating well. Would the exercises in LOUD and LSVT Loud for Life help my concerns?
Yes, yes. So definitely, Loud, that is what Loud is targeting, is the also the speed of or the rate of speech. So yeah, the answer is yes, very much so.
How long do I have before my voice starts to improve?
So that's very, I would say it's really, and it's the individual, right? We always say it's very specific to the individual, how that individual responds to the treatment. But I have patients who, after that first week, we've got them to um, what is basically normal loudness. So, we're able to recalibrate them, and it could be as quickly as 1 week. It could also be, I've worked with Parkinson's patients for years, and they need that support, to keep that voice or to maintain that vocal loudness. So it's very specific to the individual.
How do you know when you are being too loud?
That's a really good question. So, you will learn that if you do the program. And basically, we give you a parameter, and I will give it to you now. So if you have a decibel meter, which you can actually use on your phone, you can find a decibel meter on your phone. What is normal is 75 to 82 dB, decibels. So that's what we work on in therapy is we try to get you to that 75 to 82. Usually our patients, when they do come for us for treatment, they're in the 60s or even 50s for that matter.
Do you offer consultations via Zoom?
I do. Very much so. I do offer consultations by Zoom. Yes, you can get in touch with us. I have my number up on the screen, and you can call Judy as well. Like I said, she will connect you to me for all your need, for all your questions. Yep.
Okay, I need to take my glasses off so I can see these. Let's see. Does every does everything you have spoken, I don't know the rest of that question. So will the person who just asked that first question, here we go. Does this apply? Does this information apply to MSA?
I'm not sure what MSA is.
Multi-system atrophy, I think.
So, I need to clarify that a little bit more. There are other disorders that actually have been researched by Loud that applies to Loud. So like MS, ALS, right? We started using Loud treatments for people with ALS and MS. I'm not sure about MSA at this time, but I can look into that.
Currently my voice is loud. Is it still worth getting an evaluation now?
So the voice right now is loud. Is so my question to you is that your perception of loud, or are people telling you that, yeah, your voice is still normal? You can always get that evaluation just to see exactly where you are at. And we act, so at least for me, from my clinic, when I do the eval and you are still within that normal range, I usually will recommend, yep, you just keep doing what you're doing. If you start to see that the voice is getting softer or you're having swallowing issues, definitely do come back and see us.
Okay, anybody have any more questions? So as Clarissa said, you can always email me through the MAPS website if you want to get in touch with Clarissa. And Clarissa, I think we were talking about, and I don't know whether we did it or not, just to offer some of these voice classes on Zoom so that if you can't get to Annapolis, oh wait, here's another question. Okay, I'll get to this in a minute.
Okay.
So that I can't talk and chew gum. Uh, but if people couldn't get to Annapolis
Mhm.
for whatever reason, so that they couldn't take your class in person, you are going to be able to Zoom a class, correct?
Yes, I think we did talk about that. I think we do have uh, a mileage restriction on that, I believe. But
Hmm.
it's something, yep, definitely. We can talk about that more. The other thing too is if they get in touch with us, either you or me directly, I can find clinicians in their area who will do the loud, and maybe perhaps Loud for Life groups in their area so that they can actually come in person. We do Zoom. All of us will do Zoom treatments. However, in person, I would still recommend that in person
In person
therapy sessions.
is always
Yeah,
better.
it's
I think
always
it's
good.
always better. But
I agree.
if in person is not available, uh, we've got the other option.
Right.
So another question that just came in is, what do you think about Parkinson's Speak Out based in Dallas?
That is definitely another option. It is, I know very little about it, but I may actually start looking into that a little bit more. So Speak Out was, I would say it was developed for patients who are not able to do the high intensity that LSVT loud requires, right? So Speak Out has pretty much the same concepts, but they are less restricted. So from what I know, that is what the difference is. So the activities are fairly similar, but it's just less restrictions. So it's not it's not those 16 sessions. It's not as high intensity, but their research is showing that it's actually also very beneficial for them. Yeah.
So would it be appropriate for maybe, so let's say you've been diagnosed with Parkinson's, but you've not yet done this LSVT loud. What would be the pros and cons of doing this over, let's say, the Parkinson's Speak Out?
Mm-hmm. So it's yeah, that's a really good question. So there's a so
Good.
LSVT loud is what I like about it is that high intensity component. So the high intensity really targets the neuroplasticity factor, right? With Speak Out, because it's not as intense, and it's also less frequent, the onus is on the participant. They have to do more exercise individually or independently without without the therapy. So it's really hard to tell which one is more beneficial, but definitely Speak Out is an option if you do not want to do the 4 days a week, right? So it's less intense. It's less intense. Yeah.
Okay, any other questions from anybody? If you think of any questions, that we don't get answered tonight, feel free to email me through the website, and I'll get the answers to Clarissa. I mean, I got the questions to Clarissa, not the answers. She'll have to supply the answers. And then we'll get your questions answered. So if that's it, thank you everybody for coming, and have a good weekend and a good summer, and we'll see you soon. Thank you.
Thank you. Thanks, Judy, for having me.
Oh,
And have
thank
a
you
good
for
night,
doing it.
everyone.
Thank you for doing it.
You're very welcome.
Have
All
a
right.
good night.
You too. Bye-bye.
Bye.